Tôi là Kim Lân Green, thông dịch viên tại bệnh viện Harborview.
Y soy uno de los intérpretes aquí en Harborview.
la yiraahdaa waxaan nahay turjubaan Soomaali.
Добрый день.
我是 Harborview 的
ខ្មែរនៅមន្ទីរពេទ្យ Harborview.
ገዛ ወልደታቴ ስብሃል ኣብ ሃርበርቪው
ጤና ይስጥልኝ ኢሌን ይባላለሁኝ ሃርበርቪው ነው።
About 17 to 18% of our patients that are seen at Harborview are limited English proficient. What we do is work with our contact center to really identify non-English speakers at their first port of contact with the system. The best way to do that is to ask every single patient in what language they would prefer to communicate about their health care. So establish a way for them to be able to communicate with their providers, with their social worker, with their doctor, with their pharmacist at every single instance of care.
My name is Abdullah. I work Harborview, and I've been working for almost 13 years as a medical interpreter. There was one day that I was on the phone and the emergency room called. The patient, a Somali gentleman, age 70, and he was very anxious and scared. And then as soon as I talked to the patient, I introduced to myself. He said, "Yeah, I recognize your voice." And it seems like he was all of a sudden like calm because he heard someone who knows in his community. And he asked me if I know the doctor. I said, "I work with him. He's very good and you are in good hand." It turned out very good, and after a few days, when I saw the patient, he said, "They really saved me, and I thank you that you were on the other side of the phone."
Ethnomed really starts from the assumption that patients and providers need to have more information about each other, especially for communities that are new to the United States. Ethnomed really is kind of a gathering of wisdom.
There are three audiences here. One audience is physicians, and specific information for physicians, like a CDC website. The other audience is patients, but very different patients, very, not English-speaking patients. And then clinic staff, nursing, and pharmacy staff as well. So to have one website with these different audiences, especially different language groups, that's, I think, one of the unique features of Ethnomed.
We work with the communities as far as gathering their input to the content through interviews and focus groups and reviews of the material. So most anything we put up usually has a clinical reviewer as well as a community reviewer. We have upwards of like 350,000 visits a year. We see that it's accessed around the country and even internationally.
Some patients will have some more complex needs, perhaps a chronic disease that requires some behavior changes, and they just really don't know how to make those behavior changes. And so the Community House Calls Project provides cultural mediators that will assist them with resolving whatever issue they are dealing with.
Most of my community who comes here, a lot of them cannot even write and read, so they're having a hard time to communicate or follow up instructions, especially when the diabetes, they have a hard time because diabetes is not something that you feel sick, and our culture is you go to the doctor when you are sick.
So how do you figure out how to cook a meal that utilizes less salt if all of your recipes call for soy sauce? The caseworker cultural mediators who have gone out with patients or groups of patients and done some shop arounds with them, pointed out to them the salt content, the fat content of these various products. It's really taking the information that the patients need to have and translating it for them in a way that they will actually be able to take it into their lives and make some needed changes. Health disparities feel like a really large problem and feel very often quite intangible. When we look at and we compare outcomes for our limited English proficient patients that are seen at Harborview, it is not unusual for them to fare just as well or better than English speakers. And for me, this is one very concrete way to level out the playing field and give people equal access.